My journey in medicine it started from an injury, but it's a combination of many things. My love for sports, an injury occurred while I was playing sports. I injured my ACL, getting into the rehab, having surgery. That's one aspect of it. The other is my love for tools and working with my grandfather with cabinetry, those type things. That all kind of combined, and I figured if I combined both of them, orthopedics was kind of been my desire since ninth grade. I do reconstruction of hips and knees, so total knee replacements, total hip replacements, and I also do revisions when total knees and total hips don't go well. So there are many times where there's just not a device, or there's just not a place you could go in a textbook to find the solution that a patient may need. So I've actually had implants made custom and worked with different companies on getting those made. We've even had to modify current equipment so it would fit for a patient, and it looks like it's a garage when you're in the operating room when you're working with metal and altering metal to fit a patient. So I've learned many things from patients. I've learned many things of what probably patients shouldn't do. You always love the patients that do exactly what they're supposed to do, but there are definitely cavalier patients out there that test the equipment we put in, test the limits of what their body should be doing. Every patient's different, and you almost have to tailor your interaction to make sure they're on the same page as you when it comes to signing them up for a procedure, getting them a chance to know you, to trust you to take them to surgery. I've had many unique experiences where I'm just not sitting in this building, I'm not in the operating room where I do deliver care. The most unique is I got a phone call from a neighbor that sled riding accident occurred, didn't go as planned, and the hospital, I think actually it was a state of emergency, and ended up taking a tractor to get them out of the ditch they were in, then put them into my truck, brought them here, x-rayed them, and then fixed them. And so I wasn't on call, but I was a neighbor, and I think when you embrace what you do and embrace the people around you, you'll go that extra mile to deliver care. When the United Hospital Ortho and Spine Center was built, I think it was a great accomplishment of bringing together the musculoskeletal system as a whole. It brought together a spine team, physical therapy team, orthopedic team that, not just because they're under one roof, the way that the building's laid out, the doctors that were hired, the staff that was hired, there's a good sense of community. When you have the ability to have easier access to different specialties to take care of one patient's multiple needs, and it's under the roof where the team all gets along, it makes delivering care quicker, it makes confidence within patients go up, and it will, at the end, make outcomes better.